for the viewers who might not understand exactly what an interventional radiologist is, maybe they've heard of a radiologist, but don't understand what interventional means. Could you give a little explanation about that and
Yes.
your experience as an interventional radiologist?
Yes, I'd be happy to. And this is great because not only do most patients not really know what interventional radiology, I hate to say it, but most doctors also don't know what interventional radiologists do. So I'll give you a 2-minute encapsulation. So interventional radiologists are actually radiologists who read all sorts of different imaging modalities. For instance, our primary training is in radiology, so we'll read x-rays, we'll read CAT scans, ultrasounds, MRIs, nuclear medicine. Some of us even read mammo. I don't. Mammo's kind of specialized, so I don't read it. But we read pretty much all the modalities. So when you go get a CAT scan or an MRI, it could be an interventionalist that actually read your study. But beyond that, interventional radiologists have additional training that requires something called fellowship. In this fellowship, they spend an entire year or 2 years doing nothing but procedural work in which we use those same techniques of imaging, for instance, CAT scan or ultrasound, to do minimally invasive surgery. So that bridge occurs during training of interventional radiology. So then when you go out into the real world and start working as an interventional radiologist, you're using that skill of using imaging and marrying it to the skill of using your hands and putting them together to do all kinds of different procedures that can be done without surgery. And that's the beauty of interventional radiologists. You can think of interventional radiologists as a minimally invasive surgeon. On an ordinary day, an interventional radiologist could be doing an intervention upon somebody's liver for cancer, curing their cancer, for instance. We could be injecting beads into somebody's uterine arteries to help shrink their fibroids. That interventionalist does that. On another day, we could be doing a thyroid biopsy because we see so many patients with thyroid nodules. We can use the ultrasound machine to guide a fine needle directly into the spot very precisely and get an answer with no surgery, no medication, no nothing, no aftercare necessary. So those are the kinds of things that we do on an everyday basis, which thankfully, because of image guidance, it allows us to do. And RFA is right in that same ballpark. So we can use RFA, which is essentially similar to a biopsy. We take a very fine needle, put some local in, and put the RFA needle directly into the nodule and cause basically a thermochemical burn that causes the nodule to shrink, almost like a scar. It's really fascinating. So and that's all done through the skin, no incisions. Your thyroid remains where it is. You don't have to change anything about your medications. It doesn't cause your thyroid to stop working so that you don't become hypothyroid. I mean, that's a big deal. With surgery, you have to take medications. A young woman may have to take medications their entire life for 40 or 50 years. They don't need to do that if they're treated with RFA for these nodules. So we do all those things. So it's a very exciting field. I can't think of any other field I could possibly want to do better. I mean, that is it for me. It was the greatest thing I ever did was going interventional. Enjoy it every day.